Hello and welcome to See What We See with Lorne and Martin. My name is Lorne Cashin. I'm the Executive Director of the Ontario Opticians Association, and I'm here with my co-host, Martin LeBeau, Deputy Executive Director of the Ontario Opticians Association.
See What We See is a podcast series dedicated to bringing you, the listeners, an optician's perspective on vision care and how that fits into your broader healthcare. On today's episode, we'll be discussing brain injury, concussions, and their relationship with vision care and eye health. We'll also be joined by Drew Laskoski. Drew's the president of the Ontario Athletic Therapists Association. Drew has an illustrious career serving high-performance athletes and owning Upper Canada Sports Medicine, a successful certified athletic therapy clinic with a specialization in concussion therapy.
Martin, I think we should start today by just talking a bit of an overview about today's topic. Because everyone's heard about concussions. We've seen a movie called Concussion, and it's just really come to the forefront. It's not a new medical issue. It's been around for years and years, but it's been ignored and misunderstood quite a bit. So I thought we'd have a look at some of the numbers that...
Absolutely.
So the numbers show it's crazy from the official Government of Canada database. And here, I'm going to give you a few numbers here, Martin. It's kind of blows me away. So I'll just read these. In 2017, 46,000 Canadian children aged 5 to 19 had concussions. Only 15% of Canadian adults can identify the best ways to treat a concussion. And 1 in 4 Canadians don't know how to treat a concussion at all. In addition to this, a few of the long-term effects of concussions, and here's what they include: trouble concentrating, memory problems, and chronic headaches and sensitivity to light. And these are just a few samples of the effects and consequences if you have a concussion. So in this episode, we're going to learn more about concussions and vision with our guest, Drew.
So we would like to welcome Drew Laskoski. And hi, Drew, how you doing?
I'm doing great. Enjoying this hot weather. Hopefully it will help people get a whole bunch of vitamin D so that they feel a lot better and we can fight off the silly COVID virus.
Oh, I agree. We're all ready for that, right? Yeah. Hey, Drew, why don't you tell us a little bit about yourself and what you do?
I've been an athletic therapist for almost 30 years now. Worked hockey, junior hockey for those 30 years with various teams. Been president of the Ontario Athletic Therapists Association for 13 years. Moved into a different role with the organization after I had some health issues, but I'm back to normal, or whatever normal is. Looking to move our profession forward on many different levels in terms of regulation and being involved in concussions and the many facets of our pretty neat profession of athletic therapy, which has like the two cornerstones of being in the field working with teams, but also being a clinician as well. So we get to provide a unique continuum of care, right from when somebody gets hurt on the field, initial assessment, first aid, referral to doctors or specialists, providing treatment, and then creating a program for them to return to sport. So it's a pretty unique profession where you can provide that dynamic scope of practice from initial injury right back to return of play.
This week's topic is the relationship between concussion and vision health. You have experience in the field. With that experience, what do you think the relationship between the two has been?
The vast majority of concussions recover in 3 to 7 days. So when we're dealing with concussions that last longer, it means that there's been more impact to the brain. So with the increased impact to the brain means that different domains within our brain have been affected. And one very important facet of it is the optical side of things. If the eyes have been injured a little bit, it makes it very hard to determine if is it the brain that's been hurt and it can't interpret the information properly that the eyes are sending it? Or have the eyes been injured a little bit and it's sending incorrect information to the brain? So that's why it's important for us as athletic therapists to at least to be able to recognize that there may be some optical involvement in the concussion, but it's also incumbent upon us to have the right referral network so that we can send those people to trained professionals that can do a much more thorough diagnostic evaluation of the patient's condition and rule out whether it is an eye injury or it is a brain injury. So, and that's like everybody says, that's the devil in the details.
So you mentioned, we talked about, you were talking about having the injury, and then we're talking about what happens after. So someone's now smacked their head. Obviously, there's tests that you would perform to try to determine if someone's had has a concussion. So what would those tests look like?
So in minor hockey and a lot of sports, the trainers are trained that if there is a suspected concussion, if there's been a trauma to the head and the child or the athlete is feeling any symptoms, they're to be removed. Those of us in athletic therapy, we're expected to have a little bit higher level of skill, so that the one test that I previously mentioned, the SCAT test, it's a series of questions that were created by a consortium of neurosurgeons and neurologists, and a lot of them were Canadian, I might mention. So that there's a great influence in concussion in North America coming from Canada. So something that we can hang our hat on a little bit about that. But the sport concussion assessment tool is meant to be administered right on the sideline. Quite often you'll hear in sports broadcasts that, oh, somebody's being taken to the quiet room. And that's typically when the athlete is taken by one of the athletic therapists or athletic trainer in the United States to a quiet room, and they administer the SCAT test. And it's a series of questions that looks at sort of the Glasgow Coma scale, your orientation, whether you know where you are, some simple word recall, number sequencing, so that we get a little bit of a snapshot of how that brain is functioning. Another test that is gaining a lot of popularity is the King-Devick test, which can be administered very quickly, and it gives a fairly accurate snapshot of how that person's brain is functioning, and it gives us some information about whether, at least as we as athletic therapists, whether that athlete can be returned to the game, or that's it, they're done. We start our protocol, they're expected to see the doctor, and they're off to jail and all that good stuff. So
I got to ask you this question. Maybe you have an answer for me, but in my reading on this, I saw someone was saying that younger athletes and females tend to take longer to get better from a concussion. Have you witnessed that?
Yes. Part of the explanation, at least, can be physical, in terms of the female brain has a little bit more movement within the skull itself. So when there is an impact to the head, and the head and neck accelerate, there's just a little bit more movement of the brain within the skull. So that means that there is more of an impact of the brain with the skull. Now, women are way smarter than men, and as soon as we males accept that, it makes our life a lot easier.
Martin, I think you have a final question.
Yeah, thanks a lot, Drew. There's a lot of great information here. But before we let you go, what advice would you share with our listeners about concussion management?
The basics are if a concussion has been suspected, 24 to 48 hours jail time. See your family doctor if it can happen quickly, and then starting light aerobic activity as quickly as possible, as long as the symptoms aren't provoked. And it may sound very basic, but those steps will have the greatest effect on over 95% of concussions that we see. And hopefully, as more and more people follow those basic concepts, that we can decrease the number of them. Another big component are playing within the rules of the games. A lot of the rules of the game are meant to protect people, and the enforcement of them is important. It starts right with the coaches, making sure that the coaches reinforce that, we play the game according to the rules. Don't take shortcuts, so that you're placing yourself in potential risk.
Oh, that's really cool. And you mentioning using technology to get people to play the game safer.
Yeah.
I think that's really great that that's being introduced. This has been great. You really enlightened us a lot about it. Again, most people don't know about concussions. Like Martin mentioned, with movies that have come out and things like that, it's coming more to the forefront. People start saying you should ban football on some things. Obviously, learning how to play safer would be the route to go.
Yeah.
So Drew, I want to thank you so much on behalf of Martin and our listeners, Ontario Opticians, for enlightening us on concussions. It's great. I certainly learned quite a bit today on it. And like I said, we appreciate you taking the time to speak with us today.
Well, I'm very thankful for the invitation. My involvement with the opticians in my area have greatly improved the results of our patients. So we need those alliances to be expanded and continued if we're going to continue to help people of Ontario.
That's great. Yep. Collaborative healthcare. That's what it's all about.
Yeah. What a concept.
We got a concept. Yeah. Let's run with it. Okay. So thanks again and be safe.
You too.
What a great conversation. That was such a pleasure to have Drew on the podcast today. Thank you again so much for joining us, Drew. We want to thank as well our sponsor for today's episode of our podcast. Today's sponsor was Essilor. So thank you very much to Essilor. Thank you, Lorne. This is Martin. We just want to say thank you to all you guys again, and join us on our next episode to see what we see.
Thanks, Martin. Thank you for listening to See What We See with Lorne and Martin. Be sure to follow us across our social media pages so you never miss an update or an episode. You can find us on Twitter at OOA_frontline. On Facebook and LinkedIn, we are Ontario Opticians Association. Follow us on Instagram at Ontario Opticians Association. That's all one word. We look forward to seeing you again on See What We See with Lorne and Martin. Take care and stay safe.